dental health aid therapy program really began as a local solution to a local problem. We just simply did not have access to oral health care. Every young child should be able to have a good experience when they go to have their oral health care needs met. And the great thing about dental health aid therapists is they are people who look like us. They speak our language, they know our cultural norms because they are us.
The dental health aide and therapists over the last 10 years have improved access in all of our villages. We're improving oral health of all the kids and young adults and adults. It's paying for itself and it's sustainable.
It goes way beyond just oral health care. These are people who live in the community. It's another job in the community, not only for the dental health aide therapist, but also for the dental assistant.
They're producing revenue, they're paying for their own salary, they're paying for at least 2 members on their team, and also producing a margin in addition to that. From whether you're an employer, it's a sustainable model. Whether you're a community member, your oral health is improving. And lastly, their jobs that are being created. All that is a win-win.
There's a shortage of dentists within the Bethel region, so dental health aide therapists are an extension that is a great need within this region especially. Having them out there doing their education, doing preventative services, they're making more of an impact within Alaska.
As a DHAT, my main goal is to provide education and prevention services to Imanak and to the surrounding villages. I provide diagnostic x-rays, cleanings, fluoride applications, basic restorative services.
I'm very confident in the services that they do provide. So they know their limitations, they know their scope of practice. Anything that they do have questions on, we're always available for consultations.
The dental therapists are the backbones of the dentists. They do care and they do a really good job.
I love having them because it's less emergencies coming in, less patients, in a significant amount of pain. We used to have just people coming from all sorts of communities, and they have really reduced that for us.
We go to the school every month and we talk to the students and also give iodine and fluoride treatment. Their oral hygiene is a lot better than what it was.
They're really moving our kids towards being cavity-free, and that's something that is definitely new to my generation, new to everyone in rural Alaska.
From my experience, I wasn't ever told how to floss my teeth, how to brush my teeth, when to brush my teeth. Now that we have our DHAT students, they take more time for the patient and they give us oral health education. Our little ones will be proof that DHATs are a great success out there.
The message that it also sends to children is that you can do this in the future. You can go on to higher education and you can be contributing back to the community.
A fantastic opportunity for them to get into a career and live at home, live in their villages, have training provided for them, go to work and have the job satisfaction when they come home in the evening every night to their family, that they're making oral health care better in rural Alaska.
It's helping the people in our region, in the YK Delta, and I hope that the other Native tribes, Native hospitals and sub-regional clinics realize they can help the whole state.
Over the life of a DHAT's career, you're going to see a significant payoff. To have that local provider from the area interacting with the community, or ideally returning to the community. I really think it's hard to put a price on that value.
Maybe It's time to give dental health aid therapy the opportunity to work in other communities in the same way that it has here.